Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Bellisio Foods is looking for you. That's right, Bellisio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Bellisio Foods is a company that truly values their employees. Apply online at BellisioFoods.com/careers.
Well, good morning, everyone, and welcome to the morning show right here on Main Street TV, where it is a little bit of a cloudy Monday, but we have 80 degrees in store for this afternoon. And that sounds absolutely fantastic to me because it is November and we're on the 4th day of November, believe it or not. And we have a very special guest in the studio today, and that is Dr. Lewis
Got it.
Gerena.
Hey.
He said like Serena with a G.
Yeah. Easiest way to remember.
Yeah, absolutely. And of course, we love our friends from Holzer who come in and share their contributions, of course, to the medical community here in our area, in our small little area. And we are so fortunate to have you here. And we talked a little bit off of the air about how you ended up in Jackson, Ohio, because you said you grew up in South Florida.
I did. I grew up on the opposite side. Yeah. Where it was a lot hotter, and we don't do winters down there, so there's a change of pace.
That's interesting. Was it a little bit of culture shock to come up here and have all the seasons and everything?
It was, but I've slowly transitioned because I was in Charleston, South Carolina for 7 years, so they get a little bit of a winter. So I was able to slowly acclimate, but we didn't get like snow, and so then I had the snow last year, but I survived. I'm here.
You're here.
Yeah, I made it. One down. Got to keep it going.
There you go. Absolutely. So let's talk for a minute about your career leading up to being at Holzer, because you did obviously grew up in South Florida. So how did you end up here?
Yeah. So I went to the University of Central Florida in Orlando for undergrad. So like I said, I grew up South Florida, went to Orlando for undergrad. And then I went to Florida State for medical school. And so that's where I got my MD degree. And then I went into family medicine first. So I did my family medicine training in Charleston in South Carolina. And so that's where the primary care sports comes from. That's the first half, right? So then I did 3 years in Charleston. And then I did my sports fellowship in Birmingham, Alabama at Andrews Sports Medicine. So that's a 1-year training fellowship. So I was in Birmingham for 1 year.
Okay.
And it was all sports medicine and orthopedics, basically. And then I went back to Charleston, where I joined my training center, and I worked there for several years as well. So when we say primary care sports medicine, it's basically non-surgical sports medicine and orthopedics. So we can... Because as you would imagine, most things I walk in, most things don't need surgery, right? If you roll your ankle, you hope, right? But if you roll your ankle, usually it's X-rays, brace, therapy, things like that. So that's kind of where I come in. So I was in Charleston for several years, and then that is where I met my now wife, and she is from Waterloo. So that is what brought us back home.
From Waterloo, the booming metropolis, huh?
Yeah, slammed. Really busy traffic, lots of deer, blocking roads. And that's currently where we still reside. So so that's what brought me up here. So I'm happy to be here, though. It's been a wonderful year that I've been here so far, and Holzer has been nothing but awesome for me.
Well, great. And, it's always good to follow a woman, I guess, if it ends up in a good spot.
Yeah, love is love.
Right? What are the things we do? The things we do. Did you ever imagine yourself being living in Ohio?
No. No, this is not on the future checklist. But that's life changes, and I can't complain. It's been wonderful, like I said.
Good.
So other than having to buy more winter gear and get used to that.
Yeah, you got to go buy the North Face jacket.
Yeah, I got all the stuff. So now I just walk around like, was it The Christmas Story?
I can't put my arms down.
Yeah, that'll be me in January. But but other than that, it's been great. So.
Well, very good. Well, we're very happy to have you here.
Thank you for
Yes.
having me. Happy to be here.
And you said that your lovely bride also works at Holzer.
Yeah. She's Dr. Chelsea Shepard. She is the psychiatrist at Holzer.
Very
So,
cool.
So she's in Maine the whole time. But yeah.
So it's a family affair.
That's it. Yeah. No, Holzer. We gotta name our first child Holzer, I guess. To fit in over here, huh?
Oh, I thought you were gonna name it Mason.
No. I mean, no. Well, I thought about it for about a split second here, and I was like, no, he's not cool enough.
Like, we like you, Mason, but you're not that cool. We could name it Little Marla. That's Mason's name.
Marla.
Yes, he replaced Marla.
Oh, I see.
Not that Marla could be replaced, but
Yeah.
he's
He's
as
trying.
Marla moved on, and Marla and I worked together for, shall we say, a few years.
Got it.
Never say long time. I just say a few years. So then there was Mason.
Yeah.
So I called him Little Marla for a long time. Yeah,
Sorry.
initiation.
Yeah.
Yeah.
And then stuck.
Yeah.
Got it.
Yeah.
Sorry, Mace.
He answers to it. It's great.
Yeah, that's his fault then. Right?
He knows, right? Exactly. He created this. All right. So, no, we are so happy to have you here in the area. A year that you've been here, and getting new patients, of course, and all of that. So let's talk for a minute about like the services that you offer, because I know, like, kind of what's the difference between what you do and maybe like an athletic trainer or something of that nature?
Sure, yeah. So I work super close with athletic trainers, right? So as a primary care sports physician, we're the physician in the office, right? So they're the doctor you come see to get that diagnosis, to get the workup. So athletic trainers are essential for what we do, though, because they're at the schools. So athlete gets hurt at the school, they usually go to their athletic trainer first, and then the athletic trainer typically will send them to us to say, hey, I think the athlete's got this going on, let me know what you think. And so I'll see them, get the x-ray, go through the x-ray, do the exam, do the workup, and then we determine, all right, this is what you have, and this is the treatment for it. And so that's kind of the difference between us. But a lot of times, too, I'll see the athlete and say, hey, you have a bad ankle sprain, now go back to the school and do some rehab with your athletic trainer to get you back into the game. So work super close with the athletic trainers. They're really essential for what we do. But that's with just the athletes. Most of what I do is actually just general orthopedics, just like I said, non-surgical. So at least half of my patient panel is people above the age of 40 that just have knee pain, right? And they come in, they're like, my knee's been hurting for the last several months. I don't know what I did. X-ray them, say, hey, you have a little bit of osteoarthritis, and this is how we can treat this. So that's where the non-surgical ortho side of it comes in. So it's nice because I can do all ages. I get the athletes and the younger people from that, and then I get the general population that just has some regular joint pain, and that's a lot of what I can offer is for that population.
So, yeah, and as we get older, we know that aches and pains, start appearing.
Yeah.
We're probably a little harder on our bodies than we were made to be. So what are some of the things non-surgical that you see that you can do to help somebody out along the way who maybe is aging but is like, I really don't want surgery?
Yeah, absolutely. So I think the most powerful thing is just education and knowledge, right? So once you know what you have and you know what you're dealing with, it makes it a lot easier to kind of adjust and plan ahead. So that's number one, is just getting the diagnosis and understanding, okay, is this something that's dangerous or is this something that's not so bad? And what can I do about it, right? So I think that's super important, is just having that proper education. And then from there, it's like, okay, now my pain is the problem. How do we treat the pain? So I do a lot of injections. So there's cortisone injections. Cortisone's been around forever. That's what most people get when you go to the office and you just get a shot. It's usually a cortisone shot, right? Sure. But we have lots of other things we offer. We have these gel injections for knee arthritis. We have these what's called PRP, or platelet-rich plasma. It's not stem cells, but it's sort of in the world of it, but that's something that's really the hot new thing that's out that athletes get all the time, but we offer that at Holzer as well.
Okay, we're gonna have to dive into that.
We'll dive into that.
Let's dive into that.
And then a lot of physical therapy, and then casting, bracing, and things like that, right? So I can do all of that. Like I said, the only thing is, once some people come in, I'm like, hey, unfortunately, this needs to get fixed, and I get you set up to the surgeon.
You should have been to see me a long time ago, right?
Yeah. Well, it's never too late.
There you
Come
go.
on in, you know?
But no, I mean, there are injuries that, of course, are going to require surgery.
Yeah.
But certainly, I don't think that any of us would come to you and say, "I can't wait to have surgery. Can we please skip this step
Yeah.
and someone cut on me?" That sounds like great.
Exactly. That's usually not their first
No.
instinct, right? And so that's why it's kind of nice to have us to give you those options and to kind of explain how it goes. And even if you do need surgery, I think it's still always helpful to have someone who doesn't operate like me. So it's not my main goal is not to operate on you, right? And
Right.
so if I do say, hey, unfortunately, I really think you need this surgery, I think it helps the patient be more confident, like, okay, yeah, maybe this is what I need to do. And it just guides them once again in the right direction. So, but like you said, there are some people that, hey, unfortunately, that's what you need, but it works. And that's why we do them. So,
Yeah. And I think that, the main thing is just to find out the peace of mind of knowing what is going on, whether you like to hear what it is or not is a whole other
That's true.
situation, but knowing is half the battle.
Yeah.
I feel like. So, okay. So you were talking about, so obviously knees are a thing, especially with the young, folks too. The older folks probably more knees, but I'm sure you see a lot of rolled ankles, shoulders, things like that.
Yep.
What are the most things that you treat, I guess?
I would say knees is number one, and then probably shoulders and hips are 2 and 3, right? And so,
okay.
yep. So hips, you can get hip arthritis, you can get hip flexor strains. So, and that goes for both old and young. So
Yep.
a young person would be like a soccer player, for example,
Sure.
that kicks too hard, and then that pulled their groin, right?
Yeah.
And then older person is just going to be someone that overdid it, and now their hips bother, right? So. But shoulders would be rotator cuff stuff. So that's the most common is, hey, my rotator cuff's torn or it's worn down. And every time I overdo it, I get some shoulder pain, right?
Okay.
And then knees is the whole gambit, arthritis, ligament tears, just general joint sprains.
Yeah.
For the younger population too, especially the sports, concussions are a really big thing too. So I do all the sports related concussions. I manage all of those as well. So that's a really big one. Talking about athletic trainers. So anytime they have
For sure.
athlete they suspect a concussion, they can send them to me and I'll do the whole workup and say, hey, yep, this is a concussion, or hey, no, I don't think this is, and go from there. So that's another big one.
Okay, because concussions are, something that you hear quite a bit now about, especially in the NFL and things like that. Can we dive into that for a second and just maybe talk
Absolutely.
about some of the things that you see, maybe some of the things that perhaps could help a youngster prevent a concussion?
So in general, when we say concussion, we're talking about it's a mild traumatic brain injury,
So
right?
what does that mean?
Yeah.
What does a concussion
So a
mean?
concussion means that, hey, you did something, got hit, and it's not even always getting hit. Sometimes if you just get tackled and you get like a whiplash motion, it'll whip your head so hard that your brain actually kind of hits the side of your skull and causes like a little shock to it, right?
Okay.
And that little shock causes some inflammation throughout some of the axons and the nerves in the brain. And that's where a concussion develops. You get this mild inflammation in there, and it essentially kind of shuts down the brain for a second. And that's why it takes forever to kind of get back, I shouldn't say forever, but it takes some time to get back to normal. So typically when you see someone with a concussion, they feel foggy, lights are bothering them, they're tired, right? They just don't feel right. A lot of times they say they feel off. And that's because that brain took that hit and now it's slowly trying to recover. Almost like if you rolled your ankle, and it takes a few weeks normally, right?
Like a big bruise, right?
Correct.
Like
Yeah.
takes a
It
while
doesn't
for-
go away
for
the
it to
next
heal.
day. It takes some time. And then your brain is the same way. And so when you have a sports concussion like that, things that are super important for the athlete and the parents to realize is that this has to be managed properly, because the
Okay.
risk you run is if you have that inflammation in there and then you go right back in and you take another big hit, you just turned a small problem into a huge problem. And then instead of coming back in 2 weeks, now it takes months or even years if it's bad
Okay.
enough. So not only will it delay your return to play, it can also cause some severe neurologic issues going down the road. So back in the day, it used to be like, oh, rub some dirt in it and you're fine and go back in. But now that we have all this evidence and this science now, and that's why the NFL, it's such a big deal now,
Yes.
we are learning that there are some serious long-term side effects that can occur if you don't manage it properly. So my advice would be for athletes and for parents out there, if the athletic trainer suspects that there's a concussion, take it seriously. Don't just kind of
Right.
brush it under the rug and put them back in because they want to play another game. Like, that's not important. What's important is their brain actually working, right? So,
Yeah, you kind of need it for life.
You need it,
stuff.
to do, at least the basic stuff, right? But so it's super important. So it's important for them to get seen by someone who manages concussions because the signs and symptoms are not always obvious. And then you want to make sure you're treating it the correct way, right?
Okay. And yeah, because as a football fan or sports fan, you said and you watch some of the hits that you see and you're like, how?
Yeah.
That didn't look bad at all. And then the next thing you know, concussion and they're out and whatever. So just because it doesn't look bad doesn't mean that there isn't something there.
And you see the opposite too. You see someone get a huge hit, and you're like,
Crunch.
they gotta be, and they get up and they're fine. And it's really just like I said, it comes down to how did your brain kind of react to that hit? Was it unexpected, and so you had that big kind of shift and it hit the wall, or were you prepared for it and it didn't really hurt as much? And there's no rhyme or reason sometimes, right? So you talked about preventing it. You can try to do things like having good posture. Specifically in football, it's having good basics, right? Know how to tackle properly. Don't dive with your head. Don't stick your head out. Some of these kids think because they have a helmet, it's now a weapon, and they dive head first.
Sure.
That's not the case. So it's proper mechanics, knowing how to tackle correctly, and even like in Tua's case in Miami, knowing how to fall correctly. Because half of his were just from getting tackled, right?
Like,
so
this dude just cannot. Somebody needs to teach this dude to fall down.
I think during one of the off seasons he did. He took a judo or a taekwondo to practice falling correctly. Not that it worked.
No,
but,
I was gonna say he's still in a bad shape.
So unfortunately, because that's my team, Miami Dolphins,
Sure.
and so it hurts every time to see it. But yeah, so it's hard to prevent them, and so I would say you can do all the things you want to do. You can wear those Guardian helmets, but really the important thing is more so identifying it and then treating it correctly.
So when you have a concussion, obviously knowing that your brain is kind of important, what are some of the treatments that you put the kids through or adults? I mean, car wrecks, any falls, anything.
Similar. Yeah. So a big part of concussions is also your eyes, right? So your eyes are very much linked to your brain. And so one thing we tell everyone is avoiding screen time. So trying to stare at your cell phone requires a lot of focus from your eyes, which also requires a lot of energy from your brain. And so that really will linger and make their symptoms worse. So number one is staying off of your small screens and phones.
Oh my gosh.
So I always say it like 4 times to the teenagers when they're in the room. I'm like, stay off your phone.
The devil.
Stay off your phone. And they know, they'll tell you because they say, yeah, I was on my phone last night and my headache was horrible. And I'm like, yeah, that's because it's not good. So that's number one. Number 2 is rest. Remember, they used to be, I think they have a concussion. Keep waking them up.
Yes.
No, don't do that. Not anymore. No. You let them sleep. Let them sleep because the brain needs to sleep.
That would make sense to me, not keep waking someone up.
So that's the old school way. We don't do that anymore. Now you let them sleep. A lot of good data recently about light physical activity is actually really beneficial. So usually the first 2 or 3 days, I tell them, hey, just rest and take it easy. But after about 2 or 3 days, you want them walking or get on a stationary bike. You want a little bit of physical activity. That little bit of increased energy will help stimulate the brain as well. That doesn't mean go practice and join a practice and no, none of that. Just a little bit of light cardio.
Take a nice walk. It's fall.
Yep. And then we talked about sleep, and then usually we just talk about maybe possible medications if they need it for their symptoms. And finally, some kids require some physical therapy. So I know I briefly mentioned it before, but I send most patients to physical therapy because you really don't realize how weak you are when it comes to a joint issue that's injured, but your body gets weak really quickly.
Very quickly.
And trying to rehab that properly is essential. And the same thing for concussions. Some kids have really high symptoms, and I'm like, hey, I think you're very symptomatic and you would probably benefit from some rehab for your eyes. So that's where you think, what do you do for a concussion for rehab? It's vestibular training. So it's your balance in your eyes, and they teach them how to properly focus again so they can look at those screens. They teach them how to get their balance back because that's a huge issue with concussions is balance, and once again, feeling off. So that exists as well.
If you've never had, I had a concussion when I was a little girl. I grew up showing horses and was at the county fair, and they had, real brilliant, somebody had built a new concrete pad for us to wash our horses on. And I was just, I mean, it was like my first year in 4-H. And one of the horses got loose and literally ran me over. I ran back. I fell back and hit my head.
Yep.
And at the time I had, again, this was a few years ago when you just dusted it off and you got back up and whatever. But I can remember that feeling of, and it took me years to realize that was a concussion.
Yeah.
Like no one ever, I didn't go to the doctor or anything. But you almost feel like you're outside of your body. It's really bizarre.
Mm-hmm.
Like it is a very bizarre feeling.
Yeah, you don't feel right. And then in the case of the athletes, I always ask the parents too. I'm like, are they acting like when they're like, no, they're way quieter than usual, or they're actually behaving, which they normally don't.
Right.
So
they're not being mouthy. I don't know.
Yeah, exactly. They're not themselves. They're being good. So people notice this. So not only do you feel off, but everyone notices. Yeah, they're acting different, and so that's another telltale sign that hey, something's not right.
Something's not right. And the last thing we want is for someone to have a brain injury or problem and it not be be treated for sure.
Especially because it is so preventable. Like, right, as long as you catch it early, and we have all this really good knowledge about it now that we can identify that. So as long as you catch it early and you treat it the right way, 99% of them will go back to normal. Right, but if you don't treat it and catch it, then you do run those risks of really long-term problems.
Maybe that explains a lot about my weirdness of brain.
That's a deeper.
That's a whole other. Yeah. I probably need to see your wife about that.
Yeah, I'll set you up. I know somebody. Right?
I appreciate that. I know a girl. Very good. So, all right, let's talk about some of the other. You mentioned injections, and of course that would be something that would be a precursor to a surgery, I would think. If we can do that and get you by, then cool.
Yeah.
So you mentioned something about blood
platelets,
or
blood
platelets.
stuff.
Yeah. Let's talk about that.
Yeah,
that's weird.
We'll kind of run through the gambit. So like you said,
please.
most stuff you see, you can usually do an injection or so prior to running into a surgery, right? There's some things that you just got to get fixed, but most of the time, especially the chronic stuff, you can treat it with an injection and see how you do, right? And the cortisone, once again, been around for forever. Cortisone is an anti-inflammatory, so it's like putting ibuprofen into the joint, right? It's just you're putting it directly in the spot versus taking it orally, which takes a much longer time. So that's how that works.
Doesn't feel good getting a cortisone injection. However,
you'll
feel better later.
Yeah. It also depends who's doing the shot.
That's true.
There's a little skill involved.
Yes.
But that's that. And then we talked briefly about the gels. The gel injections are like a lubricant. So I tell people it's like putting oil back into a squeaky, a joint in there.
So you put WD-40 in people is what you're saying.
Yeah, basically.
Okay.
Yeah. So if you want to just go to the home, the hardware store and bring it yourself, that's fine. But that's been approved, but that's just for knee arthritis. So that's the only thing we have for that. And then the blood one. So if you look into the whole world of biologics and stem cells, you'll see all sorts of things. But there's a lot of good evidence saying this works or this doesn't work. And I would say majority of the stem cell stuff, not very effective yet. Now, they're getting better at it, but there's not a lot of like home run data saying, oh man, this is 100% going to help. Sure. The one that has been shown to be very effective, though, is that platelet-rich plasma. And so that is not stem cells because it's just your platelets. So if you drew your blood and you spin it down, it has 3 layers. It has red blood cells, white blood cells, and then your platelets. And your platelets are what heals you after like a cut. So if you cut yourself and you get a scab, that's because of the platelets, right?
Which they're doing their job.
They're doing their job.
They're protecting.
Yeah, they're stopping the wound and they're healing it correctly. Yeah. And so the science behind that was like, well, maybe if we take those platelets and we inject them into these partially torn tendons, maybe it'll heal it the same way. And that's what it's been shown to do, right? So this PRP is really effective for those small tears. You'll see super common in the shoulders for rotator cuff, like we said. People will kind of have a chronic nagging pain. I've had this for 10 years, and if I overdo it, if I throw a ball too hard, it bothers me, right?
Sure.
You get an MRI and it says, yeah, you got a small rotator cuff tear. It's not big enough to go in there surgically, but it's enough to bother you. That's where this PRP is pretty handy. We also use it for knee arthritis as well. So that's another really common thing. So in the case of osteoarthritis, your cartilage, which is your cushion, it's worn down a little bit. My analogy is it treads on the tire. You got tires. You put so many miles on them, they're gonna wear down, and then eventually, if you get a bald tire, you get a new tire, and that's where you get a knee replacement.
Right.
So, and that's the surgery for that. But before you get to that stage, you can try different things to try to calm down and delay the wearing of the tire. And that's where that PRP comes in. So it's an option. And we do offer it at Holzer, like I said, and it's pretty effective in the right individual, right? It's not good for everyone, but that's where we come in, talk to me, we'll get your x-rays, and then we'll have that discussion of, hey, is this right for you, or should we try something else?
Yeah, and that's why they come see you.
Yeah, that's why you got to come in.
So do you use your own blood, or is it borrowed from like a blood donor?
Just the patient's blood.
Really?
Yep. So you come in, I'll draw your blood. It's only about 15 milliliters, a small tube. And then I spin it in my centrifuge, and it separates, and I take out that platelet layer, and boom.
That is
fun. So that's what's nice. It's yours.
Cool.
It's not someone else's. It's not any. Yeah.
I mean, that does mean something, right? To people, as there are things that I guess if you can get your own blood, it's good. Yeah. I guess that's my point.
Yeah.
Without getting into all kind of trouble about that. Okay, so that is so fascinating.
Yeah, you'll see if you same thing. NFL, watch these sports, and like these people get injured, and I would say most of them are getting that. The professional athletes, and then, we did it a lot where I trained at in Birmingham, because they had a lot of professional athletes there, and so a lot of them would get it, and it really does help speed up healing time, speed up recovery time. So it's effective, but like I said, it's effective for the right person and the right treatment too. Depends on what you got. Right.
Yeah, my husband played baseball in college, and he, to this day, he pitched, and he'll go to just throw the frisbee for the dog or something, and the next thing you know, he's like, oh my God. And it's like a week of I don't know, like it's just, I think, a permanent thing that sometimes gets aggravated.
Yeah, I mean, you put so much pressure on that elbow for so many years, it's probably a little worn down compared to most elbows, right? And
and he said like right in here too, I think. But anywho,
well, you got my name.
There,
he knows who to look for.
I can't wait to tell him I got a guy now for you.
Yeah.
Speaking of, if someone is out there listening today, do they need a referral to come see you? And where can they come and see you?
Yeah, so I will be in Jackson on Mondays at our hospital on Burlington Road there.
Okay.
We have the offices on the side there. So Mondays I'm here in Jackson. The rest of the week I'm in Gallipolis. And if you want to make an appointment, I think it's insurance dependent, but in general, no, you can just call and make an appointment with me. You don't need a referral for that. And it's 1-855-4-HOLZER, so the regular scheduling line for Holzer, or you can go online and make an appointment with me online as well.
And we don't talk enough about the Holzer.org website, which is so very handy because if you are a patient, you have your own patient portal. You have your test results there. You can pay your bill online. You can communicate with your doctors online. You can schedule appointments. All of this stuff you can just do online.
Yeah, I love the portal. I tell people all the time,
cool.
like, hey, just if you're not getting better in 3 or 4 weeks, just shoot me a message, let me know, and either I'll say, hey, come on in, or we need to order this or that. And I think it's super convenient to use. Yeah.
And I know when Dr. Gaines was in the other day, he was talking about the fact that way people, if you pick up the phone and you call me and I'm working lunch at the brewery or whatever, like I might not be able to pick up the phone. So on your own time in the portal, you can communicate back and forth.
Yeah, absolutely. As you would imagine, we're pretty busy most days. And so it's a lot easier to be able to answer those messages at lunch or at the end of the day, and they're waiting there for us versus trying to catch a phone call. Then you're just playing phone tag all day.
Yeah, it's just
You never get a call back.
no, it's just so annoying, and then everybody just gives up.
Yeah. So Portal's excellent, and then you also can look up your providers too. So if you forgot everything I said today and you wanted to see who I was, you can always find me online too.
Just remember Serena with a G.
Yeah, there you go. Exactly. You see it?
Dr.
Sticks.
Serena with a G.
It sticks. That's it. But yeah, you can find my picture, profile. It's all on the website as well. So.
There you go. And you can, if you want to learn all about Florida, you can learn from the doctor as well. Okay, so you are seeing patients mostly in Gallipolis, but are here in Jackson, fortunately for us, 1 day a week on Mondays, which will be really good, which is why you're here today, right?
Yeah, absolutely.
So very, very cool. All right. So what are some of the other reasons someone might come to see you other than, maybe sports related?
Yeah, just those chronic kind of pains, like hey, like you were talking about the elbow, right? And it's like, hey, this has been going on for a long time, and I'm like, I just kind of want to know what I'm dealing with, right?
Yeah.
So you don't have to be an athlete. You didn't have to be an athlete if you have a joint that's bothering you, if your knee's hurting you, your shoulder, or something, and you just want to know what you're dealing with. Come in and get it looked at. I have a lot of people come in and it doesn't really bother them too much. They just want to make sure they're not damaging it further, right? And so
that is a really good point.
Yeah, they'll come in. They're like, hey, whenever I do this certain activity, it bothers me. I can tolerate it, but I just want to make sure that I'm not damaging it by keep doing this thing. And most of the time, the answer is no, you're not. You're fine, right? So, but just having that peace of mind, I think, goes a long way. And then you get a little more information about it too. So I would say chronic joint pain, or even acute, not even just chronic, but hey, you fell off that ladder, putting up your Christmas lights,
We've all been there.
You want to get your ankle looked at, just come in, get it looked at, and make sure that it's not broken and it's okay. So, sports for the athletic individuals, but any type of muscle or joint issue, come in and get it checked out and make sure you're doing okay. I would say those are most common things, and then the sports concussions, definitely.
Definitely, don't mess around with that.
No.
If there's any doubt, come see you.
Yeah, absolutely. Yes.
For sure. All right. Well, we have a few minutes left, and I'm not going to let you leave because I want to hear about your time. I want to know what it's like this is personal stuff.
Yes.
I want to know what it's like growing up in South Florida versus living in Ohio, which you never thought you were going to do, by the way. But what's it like to see the seasons, and did you know what you were missing, or do you like it, or would you rather just be warm all the time?
Yeah, no, I think the seasons are beautiful, and all the leaves changing right now. It's really pretty and nice to see. And I do like the snow as well. I think, but visiting
in moderation.
Visiting it. And then, so my stepmom's from Michigan. So we used to go up in winter during Christmas and visit her family.
Okay.
So I have seen snow and it's always fun, but then having to live in it was new. So I before I moved up here, I got rid of my sedan and got a truck that it was 4-wheel drive that would be able to handle it.
If there's anything more stereotypical than the guy saying I bought me a pickup truck to move to Gallipolis, Ohio.
It's also, you got to remember, we're in Waterloo where we live. So we're in those windy roads that they're not all paved.
No.
So yeah, Chelsea, she was like, you're going to want a 4-wheel drive car, which I didn't have. So I got that. That was step one, right?
Okay. Hey, you're doing well so far.
I'm still alive. So that's more than, what some people guessed. So, we're still here. But, and then in Florida where I grew up in very suburb city. So, lots of roads, lots of people and whatnot. So, I get made fun of all the time around here because it was all right, I didn't have to mow my own lawn and home or in Charleston. I just paid someone to do the tiny little land.
You could do it with scissors.
Yeah, because I was lazy. But now we have 5 acres to mow, and so I'm on the zero turn every other week.
Love that.
So that was a new thing for me. We have a lot of trees, and so chainsawing them down and cutting them in pieces. So that was a new thing I had to learn. I still have 2 hands. So I think that's progress.
It is. Yeah. I will say, be respectful of the chainsaw.
Oh yeah, I know. Trust me.
Yes.
Yeah, absolutely. So those were new changes, and then really just the roads too. So I didn't know I had motion sickness until the first time I came up here, and I was in the passenger seat as she was driving around, and so that was new. So yeah, so now I've gotten used to them now. At first driving these windy like 141. I was like, how is the speed limit 55? I'm going to run off of the road, but I figured it out. So those were, I'd say some of the biggest changes was just learning how to live and get used to the property and the land and everything. But I think I got it down pretty good so far.
Good deal. And you've done that all within a year.
Yeah, exactly. I mean, I didn't have a choice. It was I had to quickly learn or never leave the house, one or the other. Yeah. So yeah, no, it's and I kind of enjoy it now. I can't, not gonna lie. So I look forward to when if we get snow. I heard every year it's less and less.
It is. It's kind of sad.
But I do like some of the snow days. So
yeah, I'm like, what I would love is if we had like one crazy snow like a year. You're just like, here it comes. I know it's coming. We can hunker down and just deal with it for a day or two and play and have fun, and then it all goes away.
Yeah, that would be ideal.
Yeah.
Yeah, you should make it happen.
We should make a call. Who could we call about that? I could write a strongly worded letter.
Whoever controls the weather. We got to figure that out,
I don't know, that's rough.
Yeah. A lot of debate these days.
Yes. I know. There's a missile being shot into the sky that,
Might be Elon Musk. I don't know.
It could
Controlling,
be.
Right? Yeah. Starlink,
be.
all that, maybe. We got to figure it out. Someone knows out there. Let us know.
Somebody does know.
Yeah.
We have the election tomorrow. Do you want to talk about politics?
No.
Okay. Yeah, me either. I was just joking.
I'm too exhausted.
If there's anything to get a guest to run out of the room, it's
politics.
So let's talk about politics and religion for a moment.
Oh, yeah. Now you really doubled up. Yeah. Oh boy, yeah.
No,
but it's almost done. That's the good news.
It is. Tomorrow, in all seriousness, tomorrow is election day. Please make sure that you get out and vote. It's one of the very few things that we can actually control in our out of control lives.
Oh, I would say the other new thing too, the deer.
Okay, so yeah, that's a thing.
I mean, we only saw deer if you drove to the middle of nowhere, but now that I live in the middle of nowhere, it's all over the place. But we didn't hunt, obviously, growing up in the city. That wasn't a thing of ours. So I like seeing the deer, but her whole family hunts, and they hate the deer around. So it's pretty hilarious, the difference there.
It is, well, okay, so here it is. There's a mindset. When my husband and I bought our land, we have 17 acres, and when we bought our land, the people that had owned it before, it was completely grown up when we bought it. There was a little path around it where the neighbors made walking trails and stuff. And that was a fight for a really long time because the people that owned it before allowed folks to hunt on the land. And we bought it, and I understand about hunting. I am not against hunting. I am not personally. I can't do it. I love most animals more than probably humans, but so that was a literally probably a 5-year fight of running people off of our land constantly. Who didn't know that we had bought it and that they could hunt still. So it's little things like that you're like, wow, I never would have thought that this was going to be an issue.
Yeah, we have several apple trees. So they would, in peak season, they'd come over and start eating the apples, which I'm like, oh, that's cool to watch. And then she's like, oh, Dad, hey, because he wanted to grow apples and collect them. So he was like, everything they could do to not have the deer eat the apple. So it's just so funny, the difference of opinion there. But I totally understand the need for hunting. I mean, you get too many deer, it's a problem.
Absolutely. I mean, so Jamie and I drove to Chillicothe yesterday, and I mean, it was uncomfortable how many dead deer there were alongside the road. It was just one after the other, and I was like, oh my gosh. So yes, you understand the need for hunting and whatever, but I too have an apple tree, one at our house, and we gave up a long time ago. And I say that we have come to an agreement with the deer. They get the bottom half, we get the top half.
Yeah, that's what it was this year for us. It was like, all right, fair enough.
There's enough for everybody. You guys stick with the bottom, we get top.
Yep. Yeah,
Cool.
yeah, that's what it was. So, and we were
It's
happy.
fair.
Yeah, we were happy with that. And it's
Yeah.
the handshake with the deer.
Yeah, the little paw
pretty much-
shake.
Yeah, that's it.
like
And we
hoof.
move on.
Yeah. We yeah, it's definitely I could see where if you weren't used to them and you see them, they're beautiful.
Yeah.
And how they run with those little skinny legs, like it's unbelievable.
But it is
They're majestic.
definitely stressful to drive through when you're there
Yes.
and you're like at night, you're like, oh, I'm on edge. For 45 minutes, I'm like, oh, all right, where are they? Where are
White
they?
knuckles.
Don't
and-
jump out. Yeah,
please.
So, yeah, I get it.
Not in my new pickup truck.
No, definitely not, please. So yeah, that's been the adjustments, but hey, it hasn't been bad, and it's been getting better every month as I just start getting used to things and figuring it out. That's it. It's just new world, and gotta figure it out, and it's doable.
It is.
Yeah.
No, it is. I laugh at my friends that live in like Columbus and the bigger cities, and we all laugh about this because we go to the big city for vacation. Everybody wants to flock down here for vacation,
Yep.
like that lives in the city. None of us are ever, I don't want to say ever happy. That's not the right word, but it's just a different change of pace.
Oh yeah, we were guilty of that, right? We once again, suburbs, city, family. We'd like go rent a cabin in the mountains, but it's glamping. It's like a fancy cabin
With
that
granite
has,
countertops.
yeah, and it has access to the grocery store 15 minutes away. But we think that we're like, mountain country.
You're really
vacationing, and
roughing
I'm
it.
like, yeah. But we were 100% guilty of that. Now now that I have had some experience, I always tell them like, that's not real. You're not doing it the right way. So yeah,
And
that was
that's
us.
all right.
That was us. Yeah, I get it. So we were constant Disney goers too, since we were so close. So
Oh, I'll bet.
we're that group.
Love Disney. I used to go all the time when I was little with my parents. We used to go all the time. And Disney, I have a theory about Disney. Disney should, not a conspiracy theory, like a good theory.
Got it.
Every child, you know how like there's necessities in the earth, like toilet paper and underwear and things like that we, should all have. Like every child should be able to go to Disney World.
Yeah.
Like it should be like
Free for kids or something.
free.
Yeah.
Like one time it should be government sponsored or something that every child gets to see Disney World.
Yeah, you think Disney could pay for that? I'm sure.
Wouldn't you?
I agree with you. It should be great. That'd be
It's-
one gift for them. At least once.
It's
you pick
something
when.
that everybody in the world should see.
I went to Cedar Point for the first time. That was fun.
Did you?
Yeah, that was awesome.
Are you a roller coaster person?
Yeah. Yeah.
Me too.
Yeah, we loved it.
I like
Yeah,
them.
it was a good time.
Although I'm with you, like my belly doesn't handle them as well as they used to.
Yeah,
Is there a scientific reason for that as we get older?
No idea.
Okay.
I'll look into it for you.
Okay, would
know.
you?
I just my totally random guess is that you just get taller, so you're farther away from the center of the earth. So that's why as kids you're better, and as you just stretch
Maybe.
out, you get further and further away. I have no idea, but so yeah, I did have
That
to take.
makes more sense than anything I've ever heard.
I had to take some motion, sickness medicine before the rides just to make sure that I can actually do them, and it worked. But it was a great time. Yeah.
What was your favorite ride at Cedar Point? I haven't been for many years now.
Oh man, I can't remember the names of them, but it was one of the big coasters. The dragster one was shut down still, and then
Okay.
I heard they had just reopened it and they shut it down like a week later again. So that one wasn't open, but it was one of the other big roller coasters. But there are a lot of them that were a lot of fun. So yeah.
Well,
Went there,
very
and then
good.
we got to go to there's the other one.
Kings Island?
Yes.
Yes.
That's on the to-do list next summer.
Yeah, it's fun too.
Yeah.
Make sure that you do there's a replica of the Eiffel Tower there.
Okay.
And it used to be funny when I was growing up. When you went to Kings Island, all you saw was the Eiffel Tower, and it was the tallest thing there and whatever. And now it's like this little miniature thing in the
Around
midst
all
of all of these ginormous rides. But they actually, if you go up in the Eiffel Tower elevator, there's like a little tour. And they tell you, like you can see all the way around the property. And there's built places there. And they'll explain to you like, what roller coaster and how like all
Yeah.
the stuff.
Yeah,
It's
that's
cool.
great. We'll have to do that.
Yeah, it's really neat. I did it not too long ago and I was like, wow, this is really cool. I don't know where this has been all my life. I've never done this before. So anywho. Well, what is your favorite thing about working at Holzer before I let you get out of here?
The people. The people. I mean, they're super accommodating. Everyone's extremely nice. You know, working at some big practices and big institutions in the past, like you're kind of another employee, and so like yeah, specifically at one of them I was at too. I don't think I ever met the CEO, right? And then, but now I see Dr. Stout all the time, and so I think it's way more personable at Holzer.
Okay.
People extremely caring. They want to make sure that you're enjoying your job, and then they also really care about patient outcomes and patient health, right? So
Sure.
they just care about the patients in general. You'll see a lot of these big hospital chains are thinking profit, 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 profit. That's you're not a person, you're a dollar.
Yeah.
Not at Holzer though. So I think the staff is extremely nice and welcoming. The leadership is welcoming, and then the physicians that work there as well are super friendly and caring. So.
Hey, listen, it's almost extortion. There's built-in accountability because you're going to see that same doctor at Walmart or Kroger or out to dinner or somewhere. And, you know,
That is a good point.
It's like we all got to work together here in this community. So let's do what's best for everybody.
Yeah. That's a huge point there. But I think it's genuine. I think that's the difference.
Is.
So that's
I agree.
Yeah, so that's what I would say that's by far that stands out the most.
Very good.
The people.
All right. Well, Dr. Gerena, we thank you so much for coming in here today.
It was great. Thank you for having me.
Come back anytime.
Will do. Sounds like a plan.
All right. Well, Pete Wilson has just walked in the door, and he can come over. We do have a message, right? Okay, and we'll be back on the other side of that with some news.
At Vinton County National Bank, we believe in supporting the areas where we live and work. Now, we'd like to honor those who also serve our communities. Our new Community Champions account is especially for first responders, veterans, active military, and anyone employed in the fields of healthcare or education. This account offers rewards, discounts, and other benefits to those who give so much to others. Vinton County National Bank, rewarding those who serve.
Good. And we are back. And want to thank Dr. Louis Gerena for stopping by today. What a fun guy. And moved from South Florida all the way up to Ohio with his wife, who is from here. So very, very cool. And really enjoyed talking with him.
A trade-off, hurricanes for winter weather.
Yeah, exactly. So, well, Pete Wilson is here after a Jackson Ironman victory, which I'm sure we'll get to in just a bit.
It's
how exciting!
It's in the stack. It was a very inspiring victory. It truly was. But we'll hit the news. You know, everything from A to Z, ups and downs, and that's just the way it is when you're trying to cover the waterfront. But
Absolutely.
you know, on Friday, of course, we had the big preview of the Jackson New Philadelphia game, and so we didn't get to do the news. So. For the folks who follow Main Street TV, we did want to mention that we did have a kind of a big story, a bad story come out Thursday that we didn't get to talk about on Friday. We had a fatality in Jackson County. It was a single vehicle box truck.
Yep.
It happened just outside Jackson on US Route 35 near the Broadway Street exit. It did not involve the exit or the entrance ramp, but that's where it was if you're thinking logistically. But a truck driver from Illinois, his name was Eric Edgardo, 49 years old, of Wheeling, Illinois. He was hitting the curve there, heading east towards Rio Grande, didn't make the curve. His box truck overturned, slid off the right side of the road. He was partially ejected, and he was pronounced dead at the scene. As far as we know, no other vehicles involved in that. The patrol was investigating, didn't hear any follow-up, didn't look for any follow-up, but that was the news that came out, late Thursday evening there. All right, of course, tomorrow is the election. And I know we are obligated to share some information with our Main Street TV audience. So tomorrow on Election Day, we'll give you, the highlights of what's on the ballot in Jackson County and Vinton County. But we will say this, we always say, we'll urge you to get out and exercise your democratic right. A lot of people have already done that.
Yeah.
Adrian,
Adrian, did you vote? Good boy.
I just checked the early voting. With that involves the early in-person voting that you do in the Board of Elections offices, as well as the absentee ballots, all of which are not back in yet. There's still time for that. But get this, Jennifer, in Jackson County, we have 20,694 registered voters.
Okay.
8,166 have already cast their ballots.
Whoa.
Now, you know, some quick math tells you that's about 40%.
Holy moly.
And we have years. Now, in a presidential election year, normally, you know, the turnout is up. But in Jackson County, we don't have any contested county level races, which you think would hurt the turnout. But 40% have already turned out. And, you know, if you go on the past, and obviously the trend now is to vote more early, people to take advantage of that, breaking from tradition, long tradition. But normally, the way I remember it, the early vote constitutes no more than 30% of the turnout. So I don't think that will hold. I think more people are coming out early this year for whatever reason. But it looks like we're going to have a super turnout.
That's great.
In Jackson County. It certainly looks like it's heading over 50%. Most of those early voters are in-person voters as opposed to absentees. There are still 300 absentee ballots that have not been returned. Just because you get an absentee ballot doesn't mean you have to return it, but most people, they wouldn't get it if they don't intend to probably vote.
Correct.
So there's going to be those plus everybody that votes tomorrow on Election Day. In Vinton County, a heavy turnout there too. In Vinton County, there are 7,000 plus voters there, registered voters in Vinton County. No, I'm sorry, 8,476 registered voters in Vinton County. They have had 2,295 come out so far there.
Wow.
No, I'm sorry, 2,734. So that's, you know, pushing 30% there, somewhere around in there. They have 200 absentee votes approximately that are still out. Most of those votes, once again, are in-person votes. 1,676 early in-person votes there in their Board of Elections. They do have some contested county government level official races going there that may help spur the turnout there. But we'll give you highlights tomorrow. Of course, we're going to have live election returns on WKOV 96.7 FM starting at 8 o'clock. The polls open at 6:30 a.m. They close at 7:30 p.m. We don't expect to get any results till 8 or a little after, so we won't come on and talk aimlessly at you before there's some returns to give. But we will be reporting from both Jackson County and Vinton County from here in the studio, and we will stay with it until all the local returns are in, and we will monitor. We know that people are going to watch the presidential race, of course, and maybe the U.S. Senate race, as well as others that are outside of Jackson County. We will keep up with all of those, too. You will not be lost, or you won't sacrifice that coverage because you're listening to us on the local. The plan is that we're going to come on every 15 minutes, starting at 8 o'clock. So like clockwork, 8, 8:15, 8:30, whether there is anything new or not, we'll come up, summarize where we're at and what's still there, for the people who want to check in. The way it has become in the last 5 to 10 years, we do not get precinct by precinct reports like we do in the old days.
Ew.
We get a chunk of them. We basically get 2 chunks, sometimes 1 chunk. And so we still want to do that, though, because we still have the opportunity to get that word out to you quicker than anybody.
Sure.
So that's what we're going to be. We'll be here tomorrow night doing that. Okay, some other things we want to tell you about. There was, if you heard sirens last Wednesday and Thursday, and we just got this information over the weekend. We knew there was something big brewing, but we didn't know it was this big. There was gigantic brush fires west of Jackson in the Caves Road area.
Oh.
It was in the Colton Fire Department's area because it's in Jackson Township. But we had multiple fire departments from Jackson County. I think there was one from Ross County. The ODNR forestry people were there too. But now get this, the firefighters worked a total of over 19 hours over 2 days because there was 2 different fires in the Caves Road area, and then one of those fires rekindled the next day. Thankfully, even though there was one structure that was threatened, no structures burned as a result of those brush fires. And that underscores once again that even though we are past the so-called drought, it is still November. The leaves are falling, they're dry. It's
Very
It's
dry.
dry overall. And you remember last Thursday how windy it was on Halloween? That didn't help them because that
Correct.
was one of the days those
Yeah.
fires turned out. But anyway, we have a report that we've just posted online on that. And of course, it will be in Wednesday's paper. Now, football. Ironmen defeat New Philadelphia 21-14. It was an inspiring victory, Jennifer. Both teams pretty kind of evenly matched,
Yeah.
I think. But Jackson won 21-14. It was 7-7 at halftime. They came out in the second half and just ran the ball. Nolan Johnson, who is our star running back,
Yeah.
they kept handing the ball to him. I think there was one pass in there. There is Nolan, by the way, carrying the ball. That happens to be the New Philadelphia quarterback playing defense, trying to tackle Nolan.
Oh, gosh.
But Nolan carried the ball 29 times.
Holy moly.
He was tired at the end, I'm guessing.
I'll bet.
164 yards and 2 touchdowns. So he scored 2 of the 3 touchdowns for Jackson. Bodie Wolford only threw the ball 10 times, completed 8 of them for 114 yards, and he threw a touchdown pass to Gavin Jones, the senior tight end.
Okay.
And here's the thing. Bodie threw 1 touchdown pass. That was his 25th touchdown pass of the year. That tied the modern record, and we believe it's probably the all-time record because of the way the game has become more passing
Sure.
than it was in the past. That was his 25th touchdown of the season, and that ties Jacob Winters, who is now at Ohio University.
Okay.
So congratulations to Bodie there. So what happens now? The Ironmen advanced to play the top-seeded team in Region 11, Division III, Columbus Bishop Watterson. They are one of the
Ouch.
teams favored to win the state title this year.
Right.
Now, they got to do it on the field, but they are 11-0, and nobody has come close to them so far this year. They defeated Warren Local 44-7 in their first-round game on last
my.
Friday. This game will be Friday. All the playoff games till they get to the state are on Friday now. It will be at 7 p.m. Watterson does not have their own field where their high school is. They play their games at Ohio Dominican University.
Sure.
I believe that's on Sunbury Road, and that is where that game will be. And, you can get your tickets online or you can get them at the gate. Online with a debit or credit card, at the gate with cash.
Will you all be there broadcasting the game?
You better believe it.
Okay, good deal.
Dan and Pete will be there, and I know Eric Landrum was out there on the blackboard or on the whiteboard. We don't have blackboards anymore. It was back there on the whiteboard, writing down all the games that Total Media is going to cover. From our different radio
Sure.
stations, because we have other area teams that have advanced to the second round of the playoffs as well. But this was a great win for Jackson, 21-14 over a very good team. And it was kind of like the Ohio State game when they beat Penn State. Remember how Ohio State got the ball back after their goal line stand and they were able to run out the clock? Wasn't
Yep.
that great?
Yep.
They're going to run, and
That was a
they
good
ran
game.
anyway. Well, Jackson did the same thing. They got the ball back against New Philadelphia with about 6 minutes to go, and they ran out the clock. New Philadelphia didn't have a chance for a last chance touchdown, and that was Nolan doing a lot of that work. Tucker Williams also ran well in that last drive as well. When they were thinking it was going to be Nolan, it was Tucker instead.
I want to give a shout out to the New Philadelphia fans too, because we had 1 million of them come in, and
They must have heard that on TV.
Well, I know. They were so fun and so just kind and nice, and they were fun to mess with, because the first group
They
was
come in
like
after or before?
They came in before. The first group was like a group of 5 guys that came in, and immediately we just started trash talking each other. And
Yeah.
they were so much fun. And then we had big groups of them come in. So they were really cool folks to get to talk to.
Right.
So I want to thank them for that.
They were good fans, because anytime you're traveling 2 hours and 46 minutes,
I mean,
you're a fan.
They were telling me that a lot of their league games, they have to travel almost 2 hours to get to. So they're like, honestly, this isn't that bad for us. It's a little bit further, but we're kind of used to traveling. And I was like, okay.
They could do it.
Yep.
Okay, well, I tell you what, the Jackson Ironmen weren't the only ones in kind of like tournament competition over the weekend. The Wellston Golden Rocket Marching Band was in their state competition.
Yeah.
The OMEA, that's the Ohio Music Education Association. There is the Wellston Band. We're putting their picture up because they did good. They went to Piqua and they got a rating of 2, which is excellent. And you know, you had bands from all over the region that were there. Of course, the Wellston Marching Golden Rockets Band under the direction of Katie King, a WHS alumna. And it was a great day all the way around. In the morning, the VFW in Wellston gave them breakfast.
Oh,
they
cool.
traveled to Piqua, which is north of Dayton, and then after their competition, they celebrated by going to the Spaghetti Warehouse, thanks to McDonald's and Jerry's Do It Center.
Nice.
So great community support, a great day for the
sure.
Wellston Golden Rocket Band. We'll have that coverage in the paper as well. All right, not much time to tell you anything else, but one thing we do want to tell you is that in Jackson, this is important. This is a little dull, but it's important too because the leaves are falling, right? And you don't
Yes,
want
they
them
are.
to stay on your property. The city of Jackson has started their fall leaf pickup today.
The big leaf sucker will be out.
Right. Well, you're supposed to put the leaves
Love that.
to the curb, not off the curb, because they don't want them to go down in the
storm
sewer or
sewer,
anything.
yeah.
So take them, push them to the edge of the curb, and beginning today, they will be making their rounds to pick up leaves. And it doesn't say how long they're going to be picking them up. They are starting today, and I imagine they will continue. They'll give people, I'm guessing no less than a week to get their leaves to the curb. But that is a separate operation from the garbage.
Yes. They have a giant leaf sucker machine that comes and disposes of them.
Right, and I
Pretty
know
cool.
that the city of Wellston has announced, we'll have this later because I don't have the details yet, but I know they're going to be doing the same thing. I think they're starting next week on theirs. So anyway, there's more to tell you, but I ran out of time, but we'll be here tomorrow to talk about the election. And I know a lot of you have already voted, but don't forget to vote.
Please.
The early voting is over now. I
Yes.
know I hyped that, but it ended at 5 o'clock Sunday.
Yep, no
And
more
there was
early
a bunch
voting.
over the weekend because Jackson County was sitting at 5,000 plus on Friday when I checked, and when I checked again, they're 8. So they
Whoa.
must have been coming out the doors.
They were busy
down
over the
there at the
weekend.
Board of Elections office in Jackson. So, Jennifer, we will be back again tomorrow, and we'll set the table on the election for the folks who haven't voted.
Very good. Well, Pete, thank you so much for spending your morning with us. And of course, to Dr. Louis Gerena for stopping by and seeing us from Holzer. And what a wonderful guy. Very fun to talk to. So, all right, we will be back tomorrow. We thank you so much for tuning in, and we'll see you then. Bye-bye.
From breaking news to heartwarming stories, the Telegram is your ticket to the latest buzz in town.
Read your daily dose of local headlines, sports, and entertainment and more in hand and on paper.
Get a print and digital subscription for only $7.95 per month. Delivered fresh every Wednesday and Saturday.
Visit thetelegramnews.com or call 740-286-3023 today.
Don't just read the news, be a part of it.